welcome to another Top Doctors Online interview where we speak with one of our leading specialists. Today, we're very lucky to be joined by Mr. Ahmed Ali, a highly respected consultant urological surgeon, to discuss a very crucial topic for many women, which is urinary tract infections. So welcome, Mr. Ali, and thank you very much for joining us. Would you like to introduce yourself and tell us a little bit about your experience or your areas of expertise?
Yeah, thank you. Thank you very much for the invite. As you said, I'm Ahmed Ali. I'm a consultant urologist. I've been practicing in Surrey for the last 5 years. I also have some private practice in London area as well at Harley Street. My main specialty is urology. As I said, mainly regarding around cancers, but also urinary tract infections, both in men and women.
Perfect. Thank you very much. We're delighted to have you with us today. So as I mentioned, and as you mentioned, it's one of your areas of expertise. We're going to talk about urinary tract infections, which is a problem I'm sure many women listening are familiar with. So to start off, Mr. Ali, could you explain what causes urinary tract infections and why women are more prone to them?
Thank you very much. Yeah, so urinary tract infection is really very common, and it's mostly common in women. And according to most of the statistics, acute urinary tract infection could happen in about 50% of women by the age of 24. So it's quite a large percentage of women that could be affected by this condition. Now, the main causes are either a bacteria starting from the gut. So is what we call, it's from a fecal contamination of the urethra. And because the urethra in women is short, they're more likely to have the infection traveling into their urinary tract system, which causes the infection. One of the other common roots of these infections is obviously sexually transmitted diseases, which clearly it could be transmitted from one person to the other. Having said that, it's important also to differentiate, and a lot of people, men and women, ask me this question: does urinary tract infection transmit sexually? The answer is no. So only if person has sexually transmitted disease, they can affect the partner, but urinary tract infection does not transmit from one person to the other. Other factors that could result in urinary tract infection are people, maybe mainly women, born with abnormalities within their urinary tract, other medical conditions such as diabetes, multiple sclerosis, strokes, or spinal cord injuries, which will affect their immunity levels. Pregnancy is one of the common causes that will increase the risk of infection in women. Also menopause, due to multiple factors, does increase the risk of infection. And certainly in my practice, I see a lot of women with new onset recurrent urinary tract infections after menopause. Other factors that we rule out are kidney stones, use of catheters, men and women, and obviously instrumentation.
Okay, so a lot of women could be affected in a lot of different ways. Absolutely.
Exactly so, exactly.
Okay, so what are the symptoms that women typically experience?
So symptoms are usually variable, but mostly pain or burning sensation when passing urine. We call that dysuria. Needing to pass urine more frequently, both day and night, but mostly at night because people tend to notice that more often, and we call that nocturia. Passing cloudy urine or dark or strong smell is another indication. Needing to pass urine suddenly, which we call urgency. Finding blood in the urine is another symptom. Some more non-specific type symptoms that could be the only symptom of either acute or chronic urinary tract infection is lower abdominal discomfort or tenderness with high temperature. But most urinary tract infections does not really lead to a very high temperature, and people feel slightly tired or feel hot most of the time with it.
Okay, and is it possible for the problem to resolve itself, or is treatment always required?
So we say 50% of urinary tract infections are simple, i.e. is not complicated, and it does not have any other factors that could make it persistent infection, and therefore it can be treated by increasing fluid intake. However, most people with symptoms will benefit from a short course of antibiotics, and that could be empirical in the first instance until urine is cultured, and then therefore subsequently, if the infection is still persistent, a directed antibiotics to the type of the bacteria can be used.
Okay, so clearly they cause a lot of discomfort. Is there any way to prevent urinary tract infections in the first place?
Yes, of course. And I always give my patients a do's and don'ts list, especially in young women, where initial education around sex is important. So we always ask them to keep the genitalia area as clean and dry as possible. Obviously, drinking plenty of fluid, particularly water, in usual circumstances is useful, but very important if women have the symptoms of urinary tract infection. And most women, after the first infection, will be able to distinguish when the infection is starting to come. Ensuring that, washing the skin around the vagina with water before and after sex, passing urine as quickly as possible after sex, the most common don'ts that we explain to them is do not wear very tight synthetic underwears such as nylon. They are found to cause recurrent urinary tract infections. Do not drink lots of alcohol drinks that might irritate the bladder, especially if they have urinary tract infection. Sugar drinks as well will encourage bacteria to grow, and therefore it's recommended that women, especially who are sensitive and likely to suffer from recurrent urinary tract infections, should avoid. And using condoms or diaphragms or caps or spermicidal lubes sometimes increases the risk of infection. And therefore, in those women who are sensitive to these type of contraception, usually should be best using a different method for contraception.
It's a lot of valuable tips. Thank you for that. Unfortunately, some women do go on to have recurrent issues of this type, and they have chronic urinary tract infections. What is defined as chronic in this case, and why does that occur?
Yeah, so that is a very good question. And I think I see that a lot in my practice. The most important first step to differentiate is urinary tract infection is the presence of bacteria in the urine plus symptoms. So therefore, testing the urine only without symptoms is not necessarily requires treatment, and it's not regarded as chronic urinary tract infection. This is termed as bacteriuria, which sometimes could be a common condition, especially in elderly men and women, but mainly women. And these conditions does not need to be treated with antibiotics, as this will only lead to bacterial resistance. So chronic infections then can be split into two types. The first one is what we call persistent urinary tract infection, and that means it's the same bacteria that we fail to eradicate from the patient. And that usually leads to the diagnosis of abnormality within the urinary tract, such as stones, obstruction, incomplete bladder emptying, etc. And treating that will be by treating the existing problem. So those patients would not benefit from long courses of antibiotics. The other type is what we call recurrent urinary tract infection, and this is usually defined as at least 2 symptomatic infections within 6 months or 3 in a year. And generally, after performing the usual tests to rule out any physical or organic problem that leading to these recurrent infections, the treatment is prevention. And one of the ways that we do help people is by trying a herbal tablet called D-Menos, and that has evidence-based compared to placebo in reducing the frequency of urinary tract infection. The other medication or the other medication that does help reducing recurrent infections is cranberry products. The evidence behind that is slightly less strong as the Menos, but it's also recommended, and people use it either as a juice, tablets, or capsules that can taken every day. Having said that, these cranberry products have to be avoided if people are on warfarin, as there will be a interaction between these two medications. The other effective treatment that we perform in women, and mainly around the menopause age, is urethral dilation, because most women with recurrent tract infections and after menopause are likely to suffer from urethral stenosis, and performing urethral dilatation under short general anesthetic normally will stop these vicious circle of recurrent infection and incomplete bladder emptying, and stop patients requiring long and frequent doses of antibiotics.
Thank you very much, Mr. Ali. And a final sort of area to discuss: how common are urinary tract infections in pregnancy, and does it have any impact on the pregnancy?
Yes, I mean, that's another very important point. So just to give you a background on the frequency of it, women between 6 weeks and 24 weeks of pregnancy are at a greater risk for urinary tract infection. So in hospital, around 4% of all admissions with pregnant women are due to urinary tract infection. Now, because of the hormonal effect on the urinary tract during pregnancy, the risk of what we call pyelonephritis, which is infection of the kidney, is much higher. And that could go up into 25% of the cases that we see with pyelonephritis in women. This is a very painful and serious condition that will require in-hospital treatment with intravenous antibiotics. Now, the most important element of preventing that is ensuring treating any bacterial growth within the urinary tract in a pregnant woman as early as possible, and also ensuring that the bacteria has been completely eradicated after completing the course of the antibiotics.
Thank you so much, Mr. Ali, for sharing your expertise with us today. I'm sure it's been really informative for people watching or listening at home in terms of preventing this type of infection in the first place, or those people who are troubled with recurrent infections of this type. So many thanks for joining us today. And I'd just like to remind anybody who's concerned about recurrent urinary tract infections, who would like to schedule an appointment with Mr. Ali, that they can do so by visiting his Top Doctors profile. You can find us at topdoctors.co.uk, where you can learn more about him and book a consultation. Thanks again, Mr. Ali.
Thank you. Thank you very much for your time, and thanks to Top Doctors.
Thank you very much.